Americans getting their COVID shots in the future could be in for a surprise. Moderna says it could charge as much as $130 per dose for its vaccine. That is significantly more than it had been charging the government, who had been footing the bill. Pfizer is also looking at a similar move. This comes as cases of the virus are rising in the U.S., fueled by a new subvariant. According to the CDC's tracking of weekly cases, more than 470,000 COVID cases were reported for the week of January 4th. That is up from the nearly 405,000 the week before. Here for more analysis is Dr. Jen Cates. She is a senior vice president at the Kaiser Family Foundation. Doctor, thanks so much for joining us. So what are some of the concerns that you and other medical professionals have surrounding the commercialization of COVID-19 vaccines here in the U.S.?
Yeah, hi, good morning. It's good to be here. I think we have to think back to 2020 when there were no vaccines at all. And at that time, the federal government made a bet and bet on vaccines coming to fruition and spent billions of dollars, as you mentioned, to pay for those, the research, the provision of the vaccines, and Congress passed legislation to ensure that everybody would get those vaccines for free. It was always the case that these would eventually be commercialized. That's where we're getting to now. And as you mentioned, both Moderna and Pfizer have announced prices that are 3 to 4 times what we saw with the federal price. Now, there's good news and bad news here. The good news is, due to protections that are built into the law, most Americans with public and private insurance will not themselves face a price. They will still get COVID vaccines for free, but the healthcare system as a whole will be spending a lot more, billions more, to provide these vaccines to people.
So then, okay, so that's good, because I was going to ask you about people without health insurance, but it looks like people will still have access. So that's one hurdle that they won't have to sort of jump over. But I imagine there's some sort of trickle-down effect when, the industry as a whole has to foot this bill somehow.
Exactly. So there's two things there. One is, yes, there's a trickle-down effect. So if prices go up, which they will, guaranteed they will go up, and we don't know how much exactly, but that will be a reality, that could trickle down to the premiums, for example, that you or I might pay. So there is, it's not that it's neutral to the consumer, but you and I can still go get those vaccines for free. But there's one wrinkle here as well. The uninsured, or those who are underinsured, are not going to be guaranteed free vaccines for COVID. So that is a problem. There's no protection that they have. There's no guarantee. So if we have another wave, if we need more boosters, people who don't have health coverage are out of luck.
So where do things stand with drugs like Paxilvid, which can help people treat themselves after infection of COVID-19?
Yeah, so Paxilvid, we're very lucky to have it, and it is a really important countermeasure, an intervention that's available to people if they get sick from COVID, particularly those who are at higher risk of getting sick. We're also going to see commercialization of that medication, and that's different than what happens with vaccines. For the most part, if you have insurance, you could still get it covered, but you're probably going to face cost sharing. So it's not going to be free as it has been. And certainly, as with vaccines, uninsured are going to have to pay out of pocket for potentially the whole amount. So Paxilvid will be there, but people will have costs for that. But still, good to remember that this is an intervention that can make a huge difference in people's life and ability to get healthy again.
Why is the government no longer funding this stuff? I mean, people are still dying because of COVID.
People are still dying because of COVID. There's still hospitalizations. This is not over. It's true that we are in a different phase, and I think everybody around the world is trying to learn how to live with this reality. But the Biden administration has put forward to Congress several requests for more money, billions of dollars, and Congress just has had no appetite to provide any more emergency funding to support the crisis. That's the issue. And so without any more emergency money, the administration can't pay for more vaccines or more treatments or more tests for people. And that's why it's being commercialized. And I think the challenge that the federal government faces is to make sure, or try to make sure, that transition is as smooth as possible and not bumpy. How does that happen if there's another wave? I think it's going to be a challenge.
According to the CDC, the number of vaccines administered in the U.S. has hit a lull despite ongoing pleas from public health officials.
Yeah.
Why is that happening?
People are tired. People are fatigued. There's a lot of misinformation and disinformation out there. And we're not it's not as dire as it was. And all of those factors combine to make people less likely to get vaccinated. So the updated booster that frankly everybody should be getting, particularly if you're over 50 and you have an underlying health condition, only 15% of the public has gotten that booster, and only 38% of those 65 and older, who really everybody 65 and older should have the updated booster. But people, as I mentioned, are fatigued. They are, they don't want to keep doing this. And I think it's hard for public health officials, myself included, or public health practitioners, to make the case that this is just an ongoing reality that we're going to have to incorporate into our lives.
So what are you seeing in regards to, as you're talking, I'm sorry, I'm going to take a little bit of a departure. I thought to myself,
Sure.
Full honesty, I'm one of those people that was like, I'm not getting the
Right.
last booster. I know, Vlad, you're like always on it.
I just got it last week.
You got the booster. I didn't get it, but you know what? I did get COVID right before Christmas.
Not funny,
Luckily,
but that is
no, but I'm a healthy person. It was like a little bit of a hiccup, and I recovered, but it was a really good reminder because I did think I've gone 3 years and I haven't gotten it. Maybe I'm not. Maybe I'm not going to get it. You know what I mean? It was such a good reminder, doctor. But that being said, I'm seeing all of these like crazy headlines about new COVID strains, Kraken, and all this kind of stuff. Where are we with this virus right now?
So right now, I think, what the headlines are talking about is a new strain of Omicron that is circulating in different places in parts of the U.S., in particular the Northeast. This is the XBB.1.5, very easy to remember name. And the issue with this new variant is that it's much more transmissible, potentially the most transmissible that we've seen. So people have to be aware of that. However, if you have had a booster or if you've had COVID recently, you're pretty well protected against getting very sick if you were to get infected. It will reduce the likelihood that you will get infected. It won't eliminate it. But if you do get COVID, you won't get as sick. And that's the power of vaccines and also protection from natural infection. But that's why it's so important. If you haven't had COVID recently, and if you haven't gotten boosted, it's really important to, like, you just got COVID, so you have some time to wait a little bit before you get a booster. But it's really important because this new variant, if you don't have that protection, could make you sick. It's not necessarily worse than what we've seen in the past, but more and more people are getting infected.
Doctor, you got to keep saying it. I know you've been probably saying it for the last 3 years, but I'm glad that you're here to say it again. Get your boosters. COVID is still around.
Yes.
Act accordingly.
Right.
Jen Cates, thank you very much.
Sure. Thank you.